Centers for Disease Control and Prevention, CDC, COVID-19, to maximize protection from the Delta variant and prevent possibly spreading to others, get vaccinated as soon as you can, and wear a mask indoors in public if you are in an area of substantial or high transmission. Contact tracing. Contact tracing is key to slowing the spread of COVID-19 and helps protect you and your family and your community. Updated February 25th, 2021, Languages, English print. Contact tracing slows the spread of COVID-19. Contact tracing helps protect you, your family, and your community by letting people know they may have been exposed to COVID-19 and should monitor their health for signs and symptoms of COVID-19. Signs and symptoms. Helping people who may have been exposed to COVID-19 get tested. Asking people to self-isolate if they have COVID-19 or self-quarantine if they are a close contact. Self-isolate, self-quarantine. Close contact if they are a close contact. If they are a close contact. During contact tracing, the health department staff will not ask you for money, social security number, bank account information, salary information, credit card numbers. Contact tracing for COVID-19 works best with everyday preventive actions. You can take everyday preventive actions to slow the spread of COVID-19. Doing so is especially important until a vaccine or better treatments become widely available. At this time, if you have been vaccinated for COVID-19, you should follow existing CDC guidance on when and how long to self-isolate. If you have COVID-19 or self-quarantine, if you are a close contact. CDC continues to closely monitor the evolving science for information that would warrant changes to the recommendations for quarantine of close contacts. Answer the call. Contact tracing video. This 1 minute long animation video with a voiceover informs the public about contact tracing and why they should answer and respond to a call from a contact tracer. Contact tracer. Voiceover. Contact tracer.
Contact tracing helps keep you, your family, and your community safe by slowing the spread of COVID-19. Contact tracing lets people know they may have been exposed and what to do next. During contact tracing, you will never be asked for money or a social security number. Your information is safe. If you have COVID-19, a public health worker will call to check on your health, answer questions, and let you know about services that could help. This information is confidential and kept private. The public health worker will also ask you where you've been and who you may have been around. These people are your contacts. The public health worker can help your contacts find testing and learn about symptoms and how to keep others safe. To slow the spread of COVID-19, answer the call from public health workers. Learn more at cdc.gov/coronavirus.
Coronavirus. Great. So that was a short 1 minute video about contact tracing introduction. So a great term is a contact tracer, a close contact, voiceover. What can you expect to happen. If you were around someone diagnosed with COVID-19, if you are around someone who has been diagnosed with COVID-19, someone from the health department may call you. Okay? Stay home and away from others. Stay away from others, especially people who are at higher risk for getting very sick from COVID-19, such as older adults and people with other medical conditions if possible. If you have been around someone with COVID-19, stay home and away from others for 14 days self-quarantine after your last contact with that person and monitor your health. If you have a fever, cough, or other symptoms of COVID-19, stay home and away from others except to get medical care and testing if recommended. Yeah, medical care and testing. Yeah, I'm blowing my nose because I don't know, there's some blockage in the nasal cavity. If you need support or assistance while in self-quarantine, your health department or community organizations may be able to provide assistance, guidance. The best way to protect yourself and others is to stay home for 14 days if you think you've been exposed to someone who has COVID-19. Check your local health department's website for information about options in your area to possibly shorten this quarantine period. For COVID-19, a close contact is someone who was within 6 feet of an infected person for a total of 15 minutes or more. An uninfected person can spread COVID-19 starting from 48 hours or 2 days before the person has any symptoms or tests positive for COVID-19. Wow. Let me read this one more time. For COVID-19, a close contact is anyone who was within 6 feet of an infected person for a total of 15 minutes or more. An uninfected person can spread COVID-19 starting from 48 hours before or 2 days before the person has any symptoms or tests positive for COVID-19. Wow, 2 days earlier. A person is still considered a close contact even if they were wearing a mask while they were around someone with COVID-19. So it doesn't matter if you have a mask or not, and you are considered a close contact. Monitor your health. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Remember, symptoms may appear 2 to 14 days after exposure to COVID-19. 2 to 14 days after exposure to COVID-19. Answer the phone call from the health department. If someone from the health department calls you, answer the call to help slow the spread of COVID-19 in your community. Discussions with health department staff are confidential. This means that your personal and medical information will be kept private and only shared with those who may need to know, like your healthcare provider. Your name will not be shared with those who come in contact with. The health department will only notify people you were in close contact within 6 feet for a total of 15 minutes or more that they might have been exposed to COVID-19 in close contact. Tell the health department staff if you develop symptoms of COVID-19. If your symptoms worsen or become severe, you should seek emergency medical care. Did you know? Health department staff may use case management or exposure notification digital tools to help with contact tracing. Exposure notification digital tools. Exposure notification digital tools. Exposure notification digital tools. If you are waiting for COVID-19 test result, now I don't. So we picked up expressions such as a close contact or in close contact, exposure, exposure notification, digital tools, health department staff seek emergency help, spread, self-isolate, self-quarantine, confidential, symptoms and signs, a close contact, symptoms and signs, self-quarantine. Answer the call, self-quarantine, self-isolate, quarantine, everyday preventive actions, a close contact. Symptoms, self-isolate, self-quarantine, a close contact. Good read. Good read. Indeed. I will just move on to I was curious about this. What is an asymptomatic case of COVID-19? The risk assessment gives person to do without the use of any antipyretics. Some patients may experience symptoms such as post-viral cough beyond the period of infectivity. Further research is needed. For more information about clinical care of COVID-19 patients, see our clinical management guidance. An asymptomatic case is an individual who has a laboratory confirmed positive test and who has no symptoms during the complete course of infection. Yet they test positive, but they don't have any symptoms during the complete course of infection. References: World Health Organization. Criteria for releasing COVID-19 patients from isolation. Okay. I am not interested in that because I am not in close contact or I didn't test positive. I've never gone through testing, self-quarantine or self-isolating. Let's go to Michigan. Trace. Just taking a call can save lives. We can't stop the spread of COVID-19 alone. We have to do it together. Social distancing is only part of the solution. The virus that causes COVID-19 spreads easily between people. To break the chain of infection, we are calling anyone who has been exposed The process is called contact tracing, and it has been used to control diseases for decades. But you have to answer the phone for it to work. If you get a call from 866-806-3447, MI COVID help, or your local health department, please answer. Calls are key. 30 coronavirus. Contact tracing. Contact contains COVID-19. How does contact tracing work? It starts with the people with confirmed or suspected infections. Public health staff reach out and ask about close contacts they've had during the time they may have been infectious. Contact tracers then call anyone who may have been exposed as quickly and sensitively as possible. Click here to find out what happens after you are tested. Contacts are given information and support to understand their risk and how to keep others safe. They are asked to monitor themselves for illness and seek help if they become ill. They may be asked to quarantine or isolate themselves, self-quarantine and self-isolate. The calls are confidential. Contact tracers protect your privacy, the privacy of patients and contacts. They don't give the name of the patient, only that they may have been exposed to someone with the infection. Answer the call. Let's zoom in. If you get a call from the health department, keep your family and friends safe by answering the call. To break the chain of infection, we are calling anyone who has been exposed to coronavirus. The process is called contact tracing, and it has been used to control diseases for decades. But you have to answer the phone for it to work. If you test positive for COVID-19, you will be asked to stay home to stop the spread of the virus. The health department will provide information about how to keep you and your loved ones safe while you recover. In Korea, you just get hospitalized, mandatory and free treatment. You will also ask for a list of people you were within 6 feet of for more than 10 minutes during the 2 days before you had symptoms. Reaching out to your contacts. Then the health department will reach out to anyone you've been in contact with to contain the spread of the virus. Contacts are given information to understand their risk and how to keep others safe. They are asked to stay home, monitor themselves for illness, and seek help if they become ill. Your identity, we will not release your name to anyone. We will never ask for personal information. Identification, like your social security number, driver's license, or credit card information. If you need medical care, call ahead to let the doctor's office, hospital, or 911 know you might have coronavirus so they can take the appropriate precautions to keep you and their staff safe. Avoid ride shares, taxis, and public transport. Avoid ride shares. Avoid ride shares. That's good expression. What else? Self-quarantine, spread, answer the phone for it to work. Contact tracing. So that's it for contact tracing, and I'm about to go to my office now. I am at home now. Bye-bye.